Welcome to LPN LaunchPad's review of complementary and alternative therapies, commonly called CAM, which have become increasingly relevant in modern healthcare settings. As patients incorporate these approaches into their health regimens, nursing professionals must understand how these therapies interact with conventional medical care and their implications for patient safety. Complementary and alternative therapies, CAMs, specifically focusing on their definitions, potential benefits, and associated risks. Understanding these fundamentals enables nurses to incorporate CAM considerations effectively into evidence based practice while maintaining patient safety standards. Complementary therapies are used alongside conventional medical treatments rather than as replacements. Benefits include enhanced symptom management, as seen with acupuncture's effectiveness in reducing chemotherapy induced nausea, and improved mental well being, supporting holistic healing. Notable risks include potential drug interactions, such as increased bleeding when garlic supplements combine with warfarin, delayed effective treatment, and quality concerns stemming from largely unregulated herbal supplements. Alternative therapies differ fundamentally as they replace conventional medical treatments, significantly impacting patient safety. Patients may choose these therapies, perceiving them as more natural or aligning with cultural values. Substantial risks include unproven approaches, dangerous delays in receiving effective care, as when homeopathy alone is chosen for pneumonia, and potential toxicity exemplified by herbs such as kava and comfrey linked to liver damage. CAM therapy usage continues to increase across diverse patient populations, with research indicating many patients don't disclose use unless specifically asked, creating potential safety gaps. Nursing professionals must recognize potential interactions between conventional treatments and CAM approaches while respecting patient autonomy. The critical nursing responsibility involves ensuring CAM therapies don't overshadow necessary medical interventions, particularly in acute situations where delays could lead to serious complications. Nursing considerations begin with assessment practices that specifically inquire about supplements and alternative therapies during intake, as many patients don't categorize these as medications. Educational responsibilities include providing non judgmental information about risks and evidence based care. The advocacy role involves facilitating the safe integration of complementary approaches with standard treatments. For NCLEX preparation, students should understand that CAM should never delay urgent or evidence based treatments, a concept frequently tested in clinical scenarios. Communication surrounding CAM requires establishing open dialogue while maintaining a non judgmental approach, as patients who perceive judgment are less likely to disclose health practices. Nurses should encourage disclosing all supplements and therapies by emphasizing that this information enhances safety rather than discouraging choices. Effective care coordination necessitates working with integrative medicine specialists, pharmacists, and other providers to ensure all aspects of treatment are considered holistically, with potential interactions addressed proactively. Ethical practice centers on respect for patient autonomy and their right to make informed healthcare decisions about complementary and alternative approaches. The scope of practice dictates that nurses remain within authorized boundaries, avoiding recommending unapproved CAM therapies beyond their training. State regulations regarding certain CAM services vary considerably across jurisdictions. This regulatory variation creates an important NCLEX testing point, as questions frequently address the legal boundaries of nursing practice concerning CAM therapies. Allopathic medicine refers to traditional Western medical approaches employing pharmaceutical agents, surgical interventions, and technology to treat disease. These approaches form the foundation of conventional healthcare. A characteristic example would be antibiotic therapy for bacterial infection, directly targeting the pathogenic organism. This conventional paradigm forms the baseline against which CAM therapies are compared, making understanding allopathic approaches essential for contextualizing CAM within the broader healthcare system. Herbal therapy encompasses plant based remedies such as ginseng, echinacea, and St. John's wort, which have been used historically across diverse healing traditions. Potential drug interactions are clinically significant, exemplified by St. John's wort, reducing oral contraceptive effectiveness and information impacting patients' family planning. Despite their natural origin, Herbal products contain pharmacologically active compounds that can interact with medications, affect laboratory tests, and cause adverse effects. Knowledge is frequently assessed on the NCLEX through questions addressing herb drug interactions. According to traditional Chinese medicine, acupuncture involves inserting fine needles at specific body points to balance energy flow, while acupressure applies finger pressure instead of needles. Both approaches demonstrate efficacy for pain management and nausea reduction, making them valuable complementary options. Research evidence continues to accumulate, particularly for chemotherapy induced nausea and chronic pain conditions, areas where nursing students should be prepared to answer NCLEX questions regarding appropriate situations for suggesting these approaches. Energy field therapies include healing touch, therapeutic touch, and Reiki, operating on the premise that manipulating proposed energy fields promotes relaxation and supports healing. Scientific evidence varies considerably, though many patients report subjective benefits in stress reduction that may support overall well being. These approaches are generally low risk when used as complementary therapies. However, nursing students should understand that scientific validation remains limited for NCLEX preparation, and they shouldn't be presented as replacements for evidence based interventions. Therapeutic massage involves systematic manipulation of soft tissues by trained practitioners, reducing stress, improving circulation, and potentially providing pain relief. Healthcare facilities increasingly incorporate massage therapy into integrative care programs, particularly for chronic pain or cancer treatment side effects. When addressing this on the NCLEX, students should recognize massage as generally safe while understanding specific contraindications such as areas of inflammation, infection, undiagnosed lumps, or recent surgery sites. Aromatherapy utilizes essential oils like lavender and peppermint to promote relaxation by activating olfactory receptors, influencing the limbic system. Reflexology applies pressure to specific points on the feet, hands, or ears, supposedly corresponding to different body regions. Both are generally low risk when used appropriately. However, nurses should educate patients about potential skin sensitivities with essential oils and contraindications for reflexology in conditions like pregnancy complications or acute injuries. Magnet therapy employs static magnetic fields for pain relief based on theories suggesting magnets affect blood flow. At the same time, imagery techniques incorporate visualization and breathing exercises to reduce stress or manage pain through mind body connections. Mind body approaches represent valuable additions to pain management with minimal side effects, though evidence for magnetic therapy remains more limited than for guided imagery. NCLEX questions may assess the ability to differentiate between therapies with more substantial evidence bases versus those with limited scientific support. Yoga integrates physical postures, breathing techniques, and meditation into a practice offering improved flexibility, strength, and stress reduction. Evidence supporting yoga as a complementary therapy continues to grow for chronic pain, anxiety, and depression, with benefits noted for cardiovascular health. Nurses should understand the benefits and contraindications for different patient populations, as modifications may be necessary for those with mobility limitations or specific health conditions, and knowledge supporting appropriate recommendations when patients express interest in yoga. The first practice question asks, which statement best distinguishes complementary from alternative therapies, with options? A. Complementary therapies replace medical care, while alternative therapies enhance it. B. Complementary therapies are for pain relief, while alternative therapies address mental health. C. Complementary therapies are used alongside conventional treatments, while alternative therapies are used instead. D. Complementary therapies are always FDA approved, while alternative therapies are not. The correct answer is C. Complementary therapies are used alongside conventional treatments, while alternative therapies are used instead. This represents the fundamental defining characteristics separating these categories, with complementary therapies working in concert with mainstream medical care, while alternative therapies substitute for such care. This distinction impacts risk assessment. Complementary approaches generally present lower risks when adequately integrated, while alternative therapies may pose more significant risks when delaying necessary conventional treatment. Our second question: a patient taking warfarin mentions starting an herbal supplement that contains ginkgo biloba. Which concern is most relevant? A. Enhanced sedation. B. Decreased warfarin effect. C. Increased bleeding risk. D. Hypoglycemia. The correct answer is C. Increased bleeding risk. This critical herb drug interaction occurs when ginkgo biloba potentiates warfarin's anticoagulant effects, potentially leading to dangerous bleeding complications. This highlights why thorough medication reconciliation must include herbal supplements, which patients might not volunteer without specific questioning. The NCLEX frequently assesses the ability to identify high risk interactions and prioritize appropriate interventions, such as patient education about bleeding precautions and communication with providers. The final question asks which nursing action is most appropriate when a patient chooses homeopathic remedies instead of prescribed antibiotics. A. Document the decision and discontinue antibiotics. B. Encourage stronger antibiotic therapy. C. Respect autonomy but explain risks of untreated infection. D. Direct the patient to a provider supporting homeopathy. The correct answer is C. Respect the patient's autonomy but explain the potential risks of untreated infection. This balanced approach honors respect for autonomy while fulfilling the duty to educate about the possible serious consequences of foregoing antibiotic therapy. This question assesses the ability to navigate situations where patient preferences conflict with evidence based recommendations. It requires nurses to balance respect for decisions with their responsibility to provide information, allowing for truly informed choices. The NCLEX often tests these principles through scenarios involving CAM therapies. This review has provided an overview of complementary and alternative therapies, highlighting definitions, benefits, risks, and implications for nursing practice. The nursing role involves assessment, education, advocacy, and collaboration while respecting patient autonomy and professional boundaries. Students preparing for the NCLEX should focus on distinguishing complementary from alternative approaches, recognizing herb drug interactions, and understanding appropriate responses to patients choosing CAM therapies. Questions may be directed to the comments for this video, where additional resources can be provided to support further learning in this increasingly important area of nursing practice. Please like, subscribe, and comment to support this channel. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.